Have you ever gotten an MRI and been told you have degenerative disc disease? Have you been told you have stenosis? I'm sure you can find it pretty overwhelming, not understanding exactly what's going on and what's happening to your body. And it's just not about back pain. It's about understanding what's going on with your nervous system. Watch today's video. I'm going to tell you the difference between degenerative disc disease and stenosis, and you can figure out exactly which one you have and what the concerns could be with it. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And our mission is to help optimize people's lives through a natural process without using drugs or surgery. I am a local chiropractor, and this is what I do for my patients. Now, if you're new to this channel, I would first ask you to like this video, subscribe to the channel, because that way you will not miss any notifications when I bring out new videos. And I bring out videos all the time to help introduce to you what's going on with your nervous system, what's going on with your spinal system, and more importantly, how can you optimize your health. Stenosis, degenerative disc disease. What's the difference? What do I have? Maybe I have both of them. Let's understand it. So stenosis is broken down into two different types. There's what's called central stenosis and foraminal stenosis. Basically, the word stenosis means narrowing. Narrowing of the area that either the spine is in, the spinal cord, or the nerve. What do I mean by that? Well, your brain sends impulses down the spine and out these nerves. So the tunnel that your spinal cord goes through, that tunnel, when it starts to get narrowed, and what can happen when it gets narrowed? Well, that could be due to things like degenerative disc disease. It could be due to degenerative joint disease. It could be due to thickening of the ligaments, arthritic bone spurs, anything, and a lot of things could cause this. With that being said, when that canal starts to get compromised, well, then what happens is that spinal cord starts to get affected. It starts to get pressure on it. Information that your brain is sending down that spinal cord is now getting slowed down, is getting compromised to where it's going to. Now, the other one is foraminal stenosis. Well, foraminal means that the nerves that are coming out from the spinal cord, the hole where they're coming out from, the foramen, that is actually decreasing in size. And when that's decreasing in size, from any of the other aspects I talked about, where it could be bone spurs, it could be thickening of the ligaments and stuff, scar tissue in there, well then guess what? That can start to get compromised, and suddenly that information that comes out of that nerve is not going to get to where it needs to get to properly. Information gets slowed down. Now that's stenosis. What about degenerative disc disease? What's that? Well, if you look at your spine, you'll see between each vertebrae there's a disc. Okay, between two vertebrae there's a disc. Now if you really look at this closely, you're going to see that as you go further down, the discs get thicker and thicker and thicker. Okay, why? Because they're like shock absorbers. Okay, they handle all the stress that goes on through your spine and they absorb that. So they're like sponges handling this. Now, understanding that as you go further down, the discs get thicker and thicker. The reason why is because the disc below is going to handle more pressure and stress than the disc above. He's going to have more on top of him. So therefore, he has to be thicker or at least the same size. The concern you have is when the disc starts to get thinner. Okay, that's the big concern. And L5-S1, that's the lowest disc in the spine. Well, that's one of the most common areas to get degenerative disc disease. Extremely common. L5-S1, L4, L5, L5-S1 for sure. With that being said, it's due to wear and tear. The water in the disc starts to get decreased, and then the disc starts to shrink. And then that shock absorbing ability starts to get reduced. And that disc can get harder too. So you lose that ability for that area of the spine to absorb that pressure that it goes through on a day-to-day basis. So if you were to do a comparison between the two and stuff, first thing is understanding the main issue between degenerative disc disease, L5-S1, let's say, and let's also say spinal stenosis. Well, in terms of the degenerative disc disease, the main issue is going to be disc wear and tear. It's going to be dehydration and stuff. And so the other side, on the stenosis side, is really narrowing of the nerve pathways and stuff. Now, the symptoms you could get, well, degenerative disc disease is things like stiffness, back pain, decreased motion and stuff. You can also get pain not only in the back, but the pain can sometimes radiate down your legs too. On stenosis, again, you could get leg pain in that too. You could get weakness in that. You could get balance issues in that too. And so all those things can be affected. When you talk about the cause, well, degenerative disc disease, the cause could be long-term stress, misalignment issues in the nervous system, also aging. Whereas in stenosis, you could have disc bulges there. You could also have things like bone spurs that are compromising that space, or thickening of the ligaments that's also affecting it. Now here's a newsflash when it comes to degenerative disc disease and spinal stenosis. You could have both. You could have both. You may not have one or the other. You may have both of them and stuff. And that's not uncommon. It's extremely common. And that means also that some of your symptoms may overlap. They both could be there. What are some symptoms that could overlap? Burning pain going down your legs, leg weakness that's happening, stuff. Your legs are about to give out on you, stuff. Numbness, tingling going down your legs, loss of sensation in parts of your leg, if not all your whole leg. You're having difficulty walking, your gait's off, and then lower back pain in general, obviously. And so what do? You know, a lot of people are saying, well, I don't want to go for medication because that just masks the symptoms. So I don't want to go for injections because I find that's just short-term relief. I don't want to go for surgery because that's a last resort for me and stuff. And so therefore, what is the first resort? What am I going to do? This is where chiropractic comes in. This is where chiropractic shines. What do we do as chiropractors? Well, our job as chiropractors is very, very simple. So as chiropractors, what do we do? Well, our job is so simple. And I always tell clients, when you understand what chiropractic does and you understand how simple it is, it really offends the mind. It's so simple. And that is, we are here to restore proper motion in the nervous system and take pressure off the nerves. That's it. It's so simple. Because what happens is you can get spinal misalignments that start to occur. Our job is to take those spinal misalignments, put them back into alignment, take that pressure off the nervous system, allow the body to start functioning better, allow the body to start moving better. Functionality, movement, flexibility, postural alignment, all these things start to improve with chiropractic care. Reducing the inflammation in that nervous system, allowing that disc to heal, allowing that pressure to come off of that nerve or those pathways and stuff so the body can naturally function the way it's designed to function. And it doesn't require drugs. It doesn't require surgery. The only question chiropractic asks is, how well is your body functioning? And if it's not functioning well, what can we do to improve it? Now, are we a cure for degenerative disc disease? Are we a cure for stenosis? No, we're not a cure. Nobody's going to cure it. But you shouldn't be looking for a cure. What you should be looking for is optimizing what you have. Get it functioning better. Just because you're functioning at 20% doesn't mean you have to live at 20%. You could improve it to 60%, 70%, 80%. The potential that you could start to experience can be very different than what you're experiencing now, but you'll never know it until you try it. Because the natural approach, the gentle approach, the chiropractic approach is the approach you should be doing first before moving on to another approach. And that's what we offer to our clients. Now, when you come see us, our approach is very, very thorough. I like to take pride in the way we do the way we see our clients. So when you come in here, we're going to do a full health history. We're going to know exactly what's going on. If you had MRIs done, if you had other imaging done, bring it. We want to see it. We want to review it. We will also take our own imaging. We have our own x-ray facility in the clinic, so we'll take our own x-rays. Then we also have state-of-the-art computerized spinal scanning stations, whereby we will scan your nervous system to see where the irritation and the issues are in your nervous system. We'll also do orthopedic testing. We'll also do neurological testing. We are going to, and on your first visit, guess what? You're not going to get adjusted because it would be ridiculous for us to adjust you because we've done all this testing, including the x-rays. I need to mark the x-rays. So I actually go through it all. I review it all. And not only am I putting together a plan of management to help get you feeling better, but I'm trying to put a plan of management to get you to start functioning better. I'm looking at the long-term aspect of it. I want to get you living your life to the fullest ability that you can hit. And that's what chiropractic care brings to you. So if you're not seeing a chiropractor today, I encourage you to, because it may make a huge difference in the way you're functioning and feeling. Now, hopefully you found this video educational. And I'm going to ask you to like this video. I'm going to ask you to subscribe to this channel if you want more tips, if you want more information on how to live your life naturally and learn more about your nervous system. And if you know of somebody else that could be suffering from degenerative disc disease, stenosis, or have a combination of both, or just having back pain in general and not knowing what to do or what's going on, send them this video. Share this video. Our job is to inform as many people as possible so they can take better care of themselves. Looking forward to seeing you again. My name is Dr. Shariff with Infinite Healing Chiropractic and Wellness Center. We're located in Oshawa, Ontario.